Like and subscribe right now, or you're going to have bad luck for the rest of the week. Medicine is an always quickly adapting, developing, and improving field. On a near daily basis, new medications, technology, practices, and breakthroughs are being developed and discovered. But, in spite of all these constant advancements, there's still some pillars of medicine in use today that are millennia old. Most patients seeing their doctors will receive contemporary medical aid. But just every now and then, a doctor may fall back on a treatment practice that seems bizarre to us today. In fact, some seem so archaic that we either don't know about them or may laugh to think they're still being used in some medical sphere today. Yet they are. And we're going to talk about such crazy medical practices right now. Crazy medical practices still in use today. Number 10. Transsphenoidal surgery. The transsphenoidal medical surgery procedure is where a specialist can reach up to the brain via an endoscope or other surgical instrument through the nose. The purpose of this surgery is to reach and remove tumors from within the skull, though such tumors aren't actually on the brain, but outside the brain. Despite how horrific this sounds, Raj Sindwani, an otolaryngologist with Cleveland Clinic, says the procedure has been practiced for centuries. The ancient Egyptians, for instance, realized that the passageway to the brain was through the nose. When preparing a body for mummification, Egyptians would perform transsphenoidal surgery to remove the brain through the nose. But these days, many doctors still use this procedure to eliminate brain tumor growths. Number 9. Honey. As honey is a natural substance, it's been used for many millennia for numerous things, not just for eating. Conventional prescriptions even include and discuss many medical uses for honey. Of course, the ways and usefulness of honey usage varies depending on the flower source, seasonal and ecological variables, and the production and processing procedures applied. Still, today, new research affirms, once again, that the tacky sweet stuff truly does have numerous one-of-a-kind nutritional properties. In addition to sweetening your tea, honey can also be applied to injuries and burns. Honey dressing often seems more viable than sulfadiazine dressing for burn casualties, too. It's been shown that patients treated with honey dressing had burns healed faster. Even if the burns might have been infected. This is because honey has antimicrobial properties that work as an antioxidant. With all this information, it's obvious that honey is an ideal decision for treatment, being natural and accessible to buy nearly everywhere. Number 8. Tracheostomy. A tracheostomy, or tracheotomy, both used interchangeably in this point, is a surgical procedure in which a third method for breathing is created by making an opening in the windpipe. Literally performed since ancient Greek times, this procedure can be carried out in an operating room or at a patient's bedside, depending on the condition of the patient. There are 4 most common reasons to perform this surgery. When there is an obstruction in the upper airway, when the patient can't be intubated, when a patient has cancer or a horrible physical issue to the neck or head, or when a patient is having a medical procedure done to the neck or head. And a tracheostomy is most often performed when a patient is expected to be on mechanical ventilation for a long period of time. It was the Greek doctor Asclepius who is credited as performing the first tracheostomy in 124 BCE. Yet, with all this in mind, a tracheostomy may be a typical and significant procedure, but it has huge risks and likely complications. Number 7. C-sections. Caesarean areas, or C-segments, have been performed since ancient Roman times, possibly before. It was a Roman law that first instituted that a dying or dead female had to undergo a required C-section to try to save the fetus. Before this law, typically both the mother and fetus would die. But when the law was instituted, there were opportunities to at least save the baby. In spite of mainstream assumption, the term C-section was most likely not named after Julius Caesar, as his mother successfully endured labor without needing the procedure. But maybe one of Caesar's family members had to have a C-section, which may have prompted the disarray over the origins of the terms. In any case, C-sections are commonly performed, with around 30% of U.S. births happening via C-section. There typically is no pain during the procedure, but pressure and a pooling sensation may be felt. Number 6. Obsidian blades. During the Stone Age, surgical tools made of obsidian or volcanic glass were used to drill openings into the skull. These clinical instruments had an insanely sharp edge. In modern times, physicians prefer stainless steel over obsidian. Obsidian is so sharp, they're unsure of how much pressure is needed to make the proper cuts on patients. Also, the obsidian may splinter, leaving fragments on and in the injury. Naturally, because there is next to no demand in many countries for obsidian tools, very few places produce them. Yet, despite this, when obsidian is used, proof has shown that such cuts may heal faster and leave less of a scar than the cuts performed by stainless steel. The usage of sharp obsidian isn't FDA endorsed for use in the US, but a few specialists in different countries do use them frequently for exceptionally fragile methods of cosmetically sensitive areas. Number 5. Trepanation. Have you ever had a migraine so terrible that you wished someone would drill an opening in your skull to make it stop? Well, quite a few people in the Middle Ages had just that idea. An operation called trepanation has been tracked back to 7,000 years ago, perhaps utilized for some ailments, including moving bone parts and detestable spirits. The operation involves penetrating an opening in the skull, which was done back in the day with no sedation, no pain relief, and the patient was conscious during the entire procedure. With today's modern medicine, this clinical practice is called craniotomy. It's utilized for 4 main things: to get to the cerebrum in order to treat issues like aneurysms, for the expulsion of liquids under the brain, for the removal of tumors, and for brain exploration. And craniotomies are always performed under fluctuating levels of sedation. Number 4. Medical leeches for venous congestion. Leeches are worms that have suckers on their front and back sides, in addition to teeth that can cut into flesh quickly, making them effective blood feeders. These characteristics make leeches valuable for bloodletting, a medical procedure traced many millennia back, in which they were used to remove blood from the body. In the 21st century, the FDA has allowed leeches to be used to treat a condition called venous blockage, where blood pools in a specific part of the body and prevents veins from sending the blood back to the heart. A venous clog may happen after a medical procedure to reconnect an appendage, like a finger or ear, or it may happen because of other major reconstructions, such as from the bosom. Leeches are highly efficient, able to suck large amounts of blood from a surgical site in only 45 minutes, allowing more oxygen to arrive at the site. What's more fascinating is that the spit from leeches contains substances with anticoagulant properties, which means they can prevent blood from coagulating. There is one real danger, though. Parasite treatment can cause anemia or iron deficiency. Number 3. Bee venom therapy. Bee venom treatment, which includes being intentionally stung by a live bee or infused with bee toxin, traces all the way back to ancient Greece. Hippocrates had faith in the medical value of bee toxin to ease joint pain and other joint issues, as indicated by the American Apitherapy Society. Apitherapy is a broad term that includes all clinical treatments depending on bee-related substances, including bee toxin, honey, or honeydew. There may be some merit to this, as bee toxin contains melittin, a compound that has anti-inflammatory properties, discussed from research in the journal Molecules. In addition for bee stings being used for reducing pain and the enlargement of arthritis, it's also used to reduce relapses, to treat tiredness, and to treat the inability in individuals with various sclerosis. However, even with some evidence of melittin, there's still a lack of logical proof that bee toxins can effectively treat such conditions, and it's not supported by the FDA for such utilization. Number 2. Maggot therapy. In contrast to many treatments so far discussed in this video, maggot treatment is rather new, only having been utilized for around 100 years. The treatment consists of applying live flies or the larvae to an injury. Military specialists first noticed the potential use of maggots when injured soldiers in the war zone seemed to recuperate faster, assuming that the flies could lay eggs in their injuries. By 1928, a Johns Hopkins doctor had fostered a method for developing medical-grade maggots and made them microbe-free prior to utilizing them in treatments. Skip to almost 100 years later. The FDA in 2004 permitted maggots to be used for medical use on injuries that would take some time to recover, like diabetic foot ulcers and pressure sores. Maggots additionally may be used for chronic leg ulcers, post-surgical injuries, and intense burns. To use maggots, they're placed on the outer layer of an injury, and then the entire injury is covered with a dressing for 2 days. During this time, the ravenous critters discharge digestive-related chemicals that disintegrate the injury's dead and tainted tissue, a cycle known as debridement. Number 1. Acupuncture. Acupuncture is a type of medication and, arguably, an art form that was created in China roughly 4,000 years ago. Its intention was to reestablish the body's inward stability by setting needles at certain pressure points. These days, people seek out acupuncture to unwind, to relieve pain, or even for sedation during a conventional medical procedure, for things as serious as open-heart surgery. Needle therapy has also become a form of preventative treatment, especially for hypertension. Research has observed that standard needle treatment therapy can bring down blood pressure. One test even observed that mean blood pressure decreased after acupuncture. But, after being checked over a period of 3 years after the procedure, the patient's blood pressure had re-standardized. Still, this means that acupuncture can possibly be used to treat hypertension ongoing. That is all for today's video. Thank you all for watching. While you're here, go ahead and click on one of these 2 videos on your screen. See you there!